my Spotify not playing? There we go. There we go. There we go. Yo, what's good, bro? Twissa. Or, I don't know what you prefer to go by now. Thando or what? Bro, the Elden Ring videos go so hard, bro. I love the videos so much. The Mario Kart music you always use, that's like the staple. Like, I love it. Was so funny, bro. Let's go. Oh, Tondo. That's how I pronounce it. My bad. That, bro. Thank you. I'm gonna be in there. You know, I'm in the notification game. Bad, bro. Also, is the stream lagging? I had to get a new you know, I use a Mac, so I use like an external. I have like an external hard drive that I used to stream off of, but that thing is messed up, so I just got a new SSD. Yeah, bro, I have so many. I have like two that's the scripts are already done, and I already recorded all the audio. I just need to like finish getting all the footage. I just need to edit them together, and so hopefully after my test this week, I have 2 tests this week. So after that, then I'll hurry up and put them out. Okay, bet. Thank you. I'm in this is my 3rd year at medical school. So, and I know my name is Beast MD, but next year around this time, I'll officially be Beast MD. And then, yeah, I do need a of course, you got to get on the Rivals, bro. On the Rivals of Ether 2. If you have a PC, that is. I play on Steam Deck. Term, what's good, bro? I finally got a new SSD, an external SSD, so hopefully my streams will run smooth. Hopefully I don't have any more of them issues. Because I realized anytime my stream would be lagging, it's just because I was trying to run with just my Mac by itself. And then I had an external hard drive that helped, but my hard drive just died on me, so. Yes, sir. That's what I'm saying, bro. Like, you're too cold with the Game and Watch Dogs, so you got to get on the rivals. You were cold. You cold in Smash Bros, bro. We got to play. We got to play regular Smash again too. Yeah, it's been a minute since I played. I played like twice in the past few months, but Cam, I'm not. I mean, Cam. I think I prefer with no Cam, but I will say when you did have the when you did have the Cam, there's one time where I'm not sure which boss it was, but they like they do the command grabs where you basically dead, and so watching your face during one of the command grabs and you were just blank face, that was like the. It's not funny because I know you were legit getting mad, but that mug was hilarious. So you should I'm cool with either. I'm trying to be locked in, bro. Let's say what's up to my boy, but yeah, I'm about to start ignoring the chat in a little bit. Oh yeah, congrats on your new Sonic video, Term. I love there's the camera topic. That's what we're going on. Your voice is getting deep too. I mean, your voice is already a little deep. Yeah, your voice is getting deep. Yeah, rest in peace to your headphones. My bad. Okay. All right, bro. Be safe, bro. Be safe, bro. You're too important to be sitting there texting and driving. Important people got to be safe when they driving. Oh, okay. You changed the recording location. Right, that's what he's saying. By the time you finish school, your voice you're gonna be the baritone. I mean, you already are baritone. You're gonna be a bass. No, but I still move with. Also, last thing I'm gonna say, if you haven't played Spark the Electric Adjuster 3, this level where this song is from is one of the coldest platforming levels I ever played in my life, bro. It's the song for the final stage. Might go hard, and like you see how long the song is, so you already know that it's on some craziness. I haven't played Unleashed yet, but it's on some Eggman Land vibes. Enjoy your evening, bro. It's just 94 and 52. One-month-old girl is brought to the emergency department. She has a history of cough and difficulty breastfeeding. Face turns red when she coughs. Guanabara pertussis. Probably timing for the HPV vaccine. Hydrophobia is most likely to be increased in this patient. cardiac output's going to be increased because of his anemia. Peripheral tissue oxygenation? I don't think so. Make sure that even if I have my screen turned off, that this thing is actually still streaming before I look like a fool. Okay, good. It's still working. Good. Let me make sure the audio works. Let me sneeze. Back to these God Dog questions. Of the cardiac findings is we have a 4-year-old girl, 4-month-old girl. She's supposed to be coming here for a routine examination. She is a preemie. After premature rupture of my veins and premature labor. She was in the hospital for the first 3 months. Sepsis and respiratory distress syndrome, not coordinated patient. Most likely causes patients hyperkalemia. 9-year-old boy, chronic renal failure. Physician for follow examination 2 days after he began enalapril therapy for hypertension. It's 2 days after he started enalapril. Okay, his blood pressure. That's good. There's enalapril. You have adrenal insufficiency. healthy 10-year-old boy had that emergency. My hand is hurting a little bit. Female newborn had mild cyanosis periodically, and then the hands and feet 4 hours after birth. Most appropriate next step. Treating this 3-year-old girl is brought to the physician by her mother. Concerned that her daughter might have been abused. When touching her area since she began daycare 6 weeks ago. Okay. Yeah, I know I did very bad on that practice exam, but now let's start to go through this mud. I wonder, do I need to put something else down here? Let me see. Some more stuff. I need to be able to like crop this. How do I crop it? Oops. To hold this down. To hold option down. There we go. How does that look? Does that look? Is that tacky? Is that tacky? Well, y'all let me know if that mess is tacky. This may involves an autosomal recessive mutation in the SMN protein, resulting in the defective mRNA synthesis in the motor neurons. In infantile form, it affects normally developing infants who are several months old. In spinal muscular atrophy, the bilateral lower brainstem motor nuclei and anterior horns degenerate, leading to progressive symmetric muscular weakness and the lower motor neuron pattern of dysfunction. Excuse me. Precocious puberty. Onset of pubertal development and secondary sexual characteristics prior to 8 years of age. From the gonads or adrenal glands, typically they tell the prediction of HGM. Treatment is dependent on underlying pathology. Underlying pathology, okay. I'm good on this. This is no longer in my steady flow state. That's only gotta come out. That boy Joker. That boy. Scores a portion of the GI twist, leading to bowel obstruction, negative vitals, intestinal malrotation, and abdominal liver stomach, and upper rotation typically presents in the first year of life. Most common initial symptom is infant's vomiting, which becomes bilious as well as the blockage of the small bowel and the retrograde flow of bile. In older children, abdominal pain is the most common presenting symptom. The diagnosis can be confirmed by imaging. Plain x-rays are required first to screen for perforation. Once perforation has been excluded, an upper GI contrast series is obtained. Imaging series may show evidence of malrotation with a small bowel obstruction, including air fluid levels and dilated loops of bowel. If not recognized quickly, valvulus can lead to vascular compromise with subsequent intestinal necrosis, perforation, and peritonitis. Facility in Will. And a 6-year-old boy was in the hospital for 1 day because of fever, lethargy, and vomiting. increased secretion of ADH because he was vomiting and he had no fluids. Of course, he was trying to reabsorb sodium in order to reabsorb fluids. The patient's hyponatremia is likely caused by syndrome of inappropriate ADH. Use of ADH by the pituitary stimulated by an increase in plasma osmolality. Also occur without stimulus in the setting of SIADH. In this patient, the cause of SIADH is likely a result of meningitis. Treatment of hyponatremia includes treatment of any underlying disease and gradual sodium correction, typically with fluid restriction. Safe rate of sodium correction is generally known within 6 to 12 days. This fool had meningitis. Oh, because of nuchal rigidity. Nuchal rigidity. And then facetious hyponatremia due to hyperglycemia can occur in patients with severe hyperglycemia. Patient glucose 150, which would not be enough to cause hyponatremia on lab evaluation. Severe hyperglycemia can lead to osmotic shift of water from the intracellular to the extracellular space, leading to dilutional hyponatremia in the serum. Okay. Sternomastoid injury. Likely experience an injury to the sternomastoid. The sternocleidomastoid muscle as a result of birth trauma. That's so stupid. I've never heard of them fools ever say sternomastoid instead of sternocleidomastoid. That is so twisted. Twisted. Oh my gosh. Leading to congenital torticollis. Torticollis. Typically begins at 2 to 4 weeks of age with frenetic position, cervical range of motion, and the mass of the SSCM. Can cause birth trauma. Causes include birth trauma, the intrauterine malposition of the head, fibrosis and contraction of SCM. Birth trauma or intrauterine head malposition may also lead to plagiocephaly. Physical therapy interventions such as SCM, which leads to the resolution of torticollis in most infants. Cervical spine, hemivertebrae. A rare condition of incomplete vertebral ossification in the cervical spine may present with cervical scoliosis, neck pain, and torticollis. Condition not associated with birth trauma will not demonstrate plagiocephaly or massive SCM. So evil. Twisted monsters. Histoplasmosis is an endemic mycosis secondary to. Where do they freaking live? Oh, because she's in that. That's where she got it from? She's in Missouri. As soon as I said Missouri, I should have been thinking of blastomycosis or histomycosis. But I would have never thought histo. I mean, she does have things. But even blasto, blasto's not even an answer choice. Pulmonary histoplasmosis is acute, subacute phases. Small calcified nodules and mediastinal hydrolymphadenopathy. Patient ventilation and muscle breaks. Non-activated macrophages. Exposure to bird of that droppings, including chickens, really. Q fever is where you get from Klebsiella pneumoniae. It's inhalation through the inhalation of spores of cattle or sheep. Amniotic fluid, which this patient did not have exposure. No, because she's only in the chicken coop. Food allergies are a component of the atopic triad: dermatitis, asthma, and food/environmental allergies. Food allergies may be IgE mediated or non-IgE mediated. Non-IgE mediated is a food protein-induced proctitis, proctolitis, and enterocolitis. Inclusive breastfeeding for at least 6 months is hypothesized to decrease the rate of food allergy in infants. Dietary avoidance of allergenic foods during pregnancy or lactation does not lead to decreased rates of food allergies in children. In actuality, introducing allergenic foods into the diet while lactating may lead to an increased likelihood of tolerance developing in the child and increased rates of food allergy. Alliteration from a large VSD is the most likely explanation for this patient's cardiomegaly. Increased pulmonary vascular. Most common condition for all patients. Heart sounds. Heart murmurs quiz. Let's see.
Hello and welcome back to the Learn Medicine Show. Dr. Coleman here. Today we are testing your knowledge on heart sounds and murmurs in a game show format called Question 1. So just to ease you into this, we're going to start with a nice easy question. Listen to the following heart sounds and select the most appropriate description. Now here are your 4 possible answers. The S3 heart sound, the atrial gallop, or normal. Listen to the following.
Kentucky.
Okay, so here are your 4 possible answers, and remember, systolic murmur, or is it the S3 heart sound?
They made it easy.
It's the appropriate description. Question and select the most. And here are your 4 possible answers. Mitral regurgitation, tricuspid regurgitation, pansystolic murmur, or ventricular septum. Okay, we're just going to pause for a moment because I recognise that this question was a little bit tricky. And the
I need to listen to this when I'm going into clinic, not before an exam. Where's my Spotify? I'm taking a song out of my playlist. No, I gotta keep this one again. This patient's cardiomegaly.
Wake from this dream, but I can't tell you the things that I've seen.
VSDs are among the most common congenital heart malformations.
I'd leave it behind if I could just change her mind. I can't believe the things that you are telling me, but something deep inside makes
VSD leads to left to right shunt, which increases pulmonary blood flow. This leads to remodeling of the pulmonary vasculature and results in smooth muscle hypertrophy. In turn, concentric narrowing of the pulmonary arterioles occurs, which results in the development of the pulmonary arterial hypertension. Severe and progressive enough, this can cause increased right ventricular pressures and associated myocardial hypertrophy, which subsequently results in reversal of the shunt. Feeling which? Shortness of breath and cyanosis. Increased pulmonary blood flow results in increased blood turn to blood HM, which may cause arterial blockage.
something deep inside makes me feel this really is
Increased pulmonary blood flow results in increased blood return to blood HM, may cause left atrial blockage.
I'm falling asleep. All the promises that I meant to keep. The sweetest of dreams. Was my life just taken from me? If I return, if I could change from what I've learned, we'd never have to hide. Everything would be alright in this paradise.
CT scan may assist in the visualization of the effusion. For septic arthritis, the main thing you want to do is you want to culture the aspirate. What is visceromegaly? Fallacy. Recurrent pyelonephritis can lead to scarring of the renal parenchyma and a loss of nephron mass, which decreases the GFR and can lead to chronic kidney disease. Common complication of chronic renal disease results primarily from impaired handling of sodium, leading to expansion of the IV volume. Let me see. I need to go use the restroom. I'm gonna use the restroom real quick.
Nothing's gonna harm you, not while I'm around. Nothing's gonna harm you, no sir, not while I'm around. Demons are prowling everywhere nowadays. I'll send them howling, I don't care, I got ways.
Of course you do. What a sweet, affectionate child it is.
No one's gonna hurt you, no one's gonna dare. Others can desert you, not to worry, whistle, I'll be there. Demons will charm you with a smile for a while, but in time, nothing can harm you. Not while I'm around.
What is this foolishness? What are you talking about?
Not to worry, not to worry. I may not be smart, but I ain't dumb. I can do it, put me to it. Show me something I can overcome. Not to worry, Mum. Being close and being clever ain't like being true. I don't need to, I would never hide a thing from you like some.
Now, Toby, dear, haven't we had enough foolish chatter? Let's just sit nice and quiet for a bit. Nothing's gonna harm you, not while I'm around. Nothing's gonna harm you, darling, not while I'm around.
Demons are prowling everywhere nowadays. I'll send them howling, I don't care.
Boys and their fancies. What will we think of next?
No one's gonna hurt you, no one's gonna dare. Others can desert you, not to worry, whistle, I'll be there. Demons will charm you with a smile for a while, but in time, nothing's gonna harm you. Not while I'm around.
desesperado quería morir. Muy agotado ya iba a parar, pero un colibrí le cantó. Cuando su canción él escuchó, al instante se sintió feliz. Su bello canto energía le dio y amor para vivir. Amaneció desesperado, pero ya está lleno de amor. Nunca dejará su vida, tiene esperanza sin dolor. La 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 la, la 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 la. Quiere ahora seguir su camino. La 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 la, la 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 la. Ya se va y el colibrí se fue cantando. No volverá.
I just made the most fire. You see the beauty? Most fire fruit bowl. Mango. Strawberry. Some tahini. Just a little bit of honey. Just a little bit. I already used the bathroom, but I've been drinking so much water. I literally have to go again one more time. So I'll be right back in like 2 minutes.
So in this video, I'm gonna walk you step by step.
What's going on, YouTube?
Okay, let me fix this thing real quick. I don't like the way my Zetterburn and my link is like that. So let's do this. Watch this. Okay, that's not what I need to do. I need to do add in a picture. Oh, my other picture's on my dang, it's on my other computer. It's on my phone. Oh. Let me just let me take off my thing real quick. go. What was I doing? Here we go. So we got this one. Okay. There we go. Okay. That's okay for now. It's okay. I'm okay with that. And then just make this a little smaller. Okay, that's pretty good. I'm okay with that for now. Now let's go into this. I need to find something to watch while I eat this mess so I don't get my hands dirty. AJ Monic Speeds. Turn my music down a bit.
Hermaphrodites influenza, along with bronchitis and sinusitis, Question 64, the thumbprint sign and lateral film. What's the next step? We want to get an anesthesiologist, not examine the throat. If we examine the throat, it can lead to laryngospasm and airway compromise. After we get an anesthesiologist, we secure the airway with intubation, if not tracheostomy, and we get IV antibiotics such as ceftriaxone. And here we see a patient in the tripod position. Question 65, children from 3 years to 10 years develop meningitis mainly from which bugs? And the answer is strep pneumonia and Neisseria. GBS and E. coli is from 3 months to 3 years, but from 3 years to 10 years, it's strep pneumonia and Neisseria. As we can see in this chart over here, that from 3 years to 10 years is strep pneumonia and Neisseria meningitis, and from 10 years, for example, to 19 years, it's mainly Neisseria. Question 66. A child develops fever, lethargy, poor tone vomiting, and bulging fontanelle after having a sore throat. Viral meningitis. They just had a viral infection. Now they have viral meningitis, typically preceded by a fever and sore throat. An important thing to remember is that viral meningitis is almost never life-threatening and does not lead to sepsis. Bacterial meningitis can be very dangerous. And what's the most common neurologic problem in bacterial meningitis? Hearing loss. Question 67. When can ceftriaxone be used in neonates? And the answer is all of the cases. Usually ceftriaxone is not used in neonates to the increased risk of kernicterus, but in these situations it's important to give it. The benefit outweighs the risk. Question 68.
Baby has conjunctivitis. What's the most likely cause? Let's say chlamydia.
One day after birth in the hospital, baby has conjunctivitis. What is the most likely cause? So 1 day after birth, the most common cause is chemical irritation. They got the erythromycin ointment, and now they have this conjunctivitis. It's just irritation. Neisseria occurs from days 2 to 7 after birth, chlamydia from days 7 to 21 after birth, and HSV from days 21 and on. Tetracycline cream, by the way, is an alternative to erythromycin cream. A final word over here is that we treat HSV conjunctivitis with systemic acyclovir and topical vidarabine. 69. A 5-month-old infant comes to the ED with paroxysmal coughing, post-tussive emesis, and apnea. What's the next step?
Post-tussive emesis. So I have Bordella pertussis. So yeah, azithromycin. Yeah, use a macrolide.
So we want to give hospital admission. A 5-month-old with pertussis should be hospitalized. In fact, any patient who's less than 6 months should be hospitalized for pertussis. We give azithromycin for 10 days and 5 days to his close contacts, such as his daycare contacts. Reminder is that transmission of pertussis is through aerosol droplets. It requires airborne precautions with a mask. This is a very contagious disease. Recall the various stages of pertussis: catarrhal, paroxysmal, and the convalescent. It's mainly in the catarrhal and the beginning of the paroxysmal that we see that it's contagious. Question 70. Cough, coryza, conjunctivitis, and rash that spreads from head to toe. What tells us that this is rubella and not measles?
Measles will have the red spot in the mouth.
The answer is painful posterior auricular lymphadenopathy. That's seen in rubella, not in measles. A reminder, in measles we see cough, coryza, conjunctivitis, and Koplik spots. And patients in measles will look much more sick, have a higher fever, such as 103 or 104. 71. A patient has a fever of 105, followed by a rash that begins on trunk and quickly spreads to the face and the extremities. What's the next step? So this
I'm not sure.
This is supportive care. This is just roseola. HHV6 and HHV7 cause roseola. It's a self-limited condition. Question 72. A 2-year-old boy plays with a girl who has chickenpox. It is now 4 days later. He has never been vaccinated for varicella. What's the next step?
I think you give him immunoglobulin, or you still give him the vaccine. I forgot. You still do some kind of treatment with them.
So we give a live vaccine because he's 2. In fact, as long as he's 1, we can give the live vaccine. Immunoglobulin is only for immunocompromised patients, and again, patients less than 1. 73. Hand, mouth, foot disease. What's the treatment for this? So we give supportive care. There's no treatment for this. It's caused by Coxsackie virus. Now, before we move on to the next question, here we just have a few reminders. Infections such as meningitis, also pneumonia in neonates, is caused again by E. coli, group B strep, and listeria. Bell is the mnemonic. And here's just a reminder of CSF findings in meningitis. Only in viral meningitis will glucose levels be normal. A little bit about signs in meningitis. Only in viral meningitis will glucose levels be normal. A little bit about sinusitis. Diphtheria are seen in questions with no history of DTaP vaccination, and we give them the diphtheria antitoxin. Cervical lymphadenitis, we treat with clindamycin, cephalosporin, or augmentin. Alright, now let's talk about the Torches infections. Toxoplasma, rubella, CMV, HIV, HSV, and syphilis. So question 74, cat feces or ingestion of undercooked meat. This is associated with Toxoplasma gondii, where we see chorioretinitis in congenital toxoplasma, hydrocephalus, and intracranial calcifications. And 75, hearing loss, blueberry muffin rash, and seizures. This is seen, so it's not congenital rubella, we don't see seizures there. Even though we see hearing loss in blueberry muffin rash, this is actually CMV. But this condition, by the way, is usually asymptomatic. Question 76, congenital encephalitis. This is seen in HSV2. Snuffles and hepatosplenomegaly. This is seen in syphilis. Here we see congenital syphilis. It often results in stillbirth, but if the patient survives, the first thing to do is get a VDRL or rapid plasmin reagent test. Pediatric neurology. Question 78, what's the most common type of cerebral palsy? It is the spastic one, the pyramidal one. Here we see the various types. Here's a little bit about cerebral palsy. You could take a look over this over here. Question 79, simple febrile seizures slightly increase the risk of developing epilepsy, but they usually do not recur and they do not cause brain damage. Pediatric oncology. Question 80, the most common childhood malignancy is ALL. 97% of childhood leukemias are acute leukemias, ALL being more than AML. Question 81, a 2-year-old girl has Horner syndrome, ptosis, meiosis, and hydrosis, and a paravertebral mass. This is concerning for
I'm not sure what would be causing a tumor up here. The medulloblastoma.
Or a neuroblastoma. Neuroblastoma is kind of like the pheochromocytoma of children. We'll talk more about it later. Question 82, a baby has these findings seen in the pictures. What screening test should be done? So this
does this mean they have that such a B? Well, I would go echocardiogram because their heart might be on the right side of their body.
This is macroglossia. Lateralized overgrowth is associated with Wilms tumor, so we have to get an abdominal
Wilms tumor. Okay.
ultrasound because this is Beckwith Wiedemann.
Yeah. I thought you.
Syndrome, where we see lateralized growth. That's why, for example, one side of the body may be bigger than the other. We have to get an ultrasound for Wilms tumor. Wilms tumor is a renal tumor of embryonal origin associated with BW syndrome, Beckwith-Wiedemann syndrome, and Wagner syndrome, where we see Wilms, aniridia, GU problems, and mental retardation, now known as intellectual disability. Question 83, a teenage boy has an anterior mediastinal mass. Remember, the anterior mediastinal masses are the T's, the terrible lymphoma. So here we're talking about terrible lymphoma, but also the thymoma and the teratoma. So those are the anterior mediastinal masses. He also has pancytopenia and hepatosplenomegaly, as well as superior vena cava syndrome, cough. So here we have an anterior terrible lymphoma causing these compressive problems leading to superior vena cava syndrome. So, and he has an enlarged left testicle. So if you have a lymphoma in a young boy, we know it's ALL, so it shows up in teenagers and young adults. It's important to recall that ALL can cause testicular enlargement. So now we're up to pediatric hematology. Question 84. Why do patients with cystic fibrosis develop bruising and epistaxis? So remember, patients with cystic fibrosis have a problem with their vitamin absorption, their fat-soluble vitamin absorption, and therefore they don't have vitamin K. If they don't have vitamin K, they don't have coagulation factor activation. This leads to the bruising and mucosal bleeding. Question 85. A 4-year-old patient's electrophoresis shows HbA 60%, HbS 40%, HbF 0. What's the most common complication of this condition? So this is seen in sickle cell trait, and the most common complication.
Oh, gotta answer this phone call.
Cause we rapping for all ages, won't stop until we top of them editorial playlists. Clyde Cyrus, metaphorical greatness. Stop saying I'm the best, that's a rhetorical statement.
Yo, my bad, Pluto. This is AJ Monix. You don't know that boy? He has like the weirdest videos, but low key, I really like his stuff. Like his stuff helps me a lot. He goes through stuff really fast. Low key, I'm just going to check KML. I just gotta see if Hitfall is finished with. Toothbrush? Oh, Hyperflame. Hyperflame. My go. Hold on, I just gotta see this mess. No, Toothbrush really is making a comeback. Yeah, stream lagging. Let me just say, I got a Spawn boy. Let's go, bro. Okay. Yeah, let me get back to my lecture while I'm eating this cereal. I'm eating this fruit. I also need to figure out how to make this font bigger. What website? YouTube live chat. Font. Here we go. This is what I was on. Default font. Is a Roboto font on here? Roboto. Hold on. Chongo 1. I guess I need to go back. Chongo 1. Imprima. Roboto. Select all. Copy. paste over this. Oh, how do I want to make it. I don't know how to fix this stupid stuff. This chat stuff is so annoying. Okay. Let's get back to the vid.
Is hematuria. Interesting that patients with sickle cell trait also the most common. What's the most common cause? Losing and mucosal bleeding. Question 85. A 4-year-old patient's electrophoresis shows HbA 60%, HbS 40%, HbF 0. What's the most common complication of this condition? So this is seen in sickle cell trait, and the most common complication is hematuria. Interesting that patients with sickle cell trait also have protection against malaria, and patients with this condition also have an increased risk of thrombosis. Question 86. A 4-year-old girl develops dark-colored urine, elevated bilirubin, and anemia hours after receiving antibiotics, ceftriaxone and zithromycin. What will reveal the cause? Was this G6PD? Well, that's X-linked, unlikely to be in a girl. Coombs test, drug-induced immune hemolysis. A 3-year-old girl from I don't know where has sudden onset weakness, hypotonia, and hyperreflexia of the right arm and leg. She has no fever. What study is most appropriate? So over here we want to get hemoglobin electrophoresis, because if we see a stroke in a 3-year-old, we have to really be thinking about sickle cell anemia, which causes vaso-occlusion leading to cerebral ischemia, i.e. stroke. Question 88. A 13-year-old girl was feeling well until a few months ago when she started feeling fatigue. She has a few brown macules on her lips and buccal mucosa. Hemoglobin is low, MCV is low, platelets are normal. Next step, we want to get an upper and lower endoscopy because this is Creutzfeldt-Jaeger's syndrome. I don't know how to pronounce it, but I think that's how you pronounce it. Autosomal dominant condition. There's hyperpigmented macules, especially on the lips and buccal mucosa, and there's also an increased risk for cancer. They need an upper and lower endoscopy to look for polyps, and that's seen in patients with this condition. Question 89. A 5-year-old boy at 5th percentile for height has easy bleeding, bruising, and anemia. MCV is 112, and the thumb is hypoplastic with flattened thenar eminences. What is the cause of the condition? So this is Fanconi anemia, and in Fanconi anemia, there's a defect in DNA repair. Treatment is with stem cell transplant. 90. The treatment for there's a defect in DNA repair condition. So this is Fanconi anemia, and in Fanconi anemia, there's a defect in DNA repair. Treatment is with stem cell transplant. 90. The treatment for ischemic stroke and sickle cell disease is we want to give exchange transfusion. Heparin will not work. Exchange transfusion improves the viscosity. Question 91. A boy from the Mediterranean presents with fatigue and pallor. His diet mainly consists of dairy products such as ice cream and milk. Hemoglobin is low. MCV is low. Erythrocytes 3 million. What will be seen? So this is iron deficiency anemia. We're going to see an elevated RDW. We'll also see a low ferritin. This is iron deficiency anemia. His diet and lower erythrocyte level makes iron deficiency the more likely answer. In beta thalassemia, we're going to see a normal or elevated erythrocyte count. 92. A baby has jaundice, hemolytic anemia, and elevated MCHC. Elevated erythrocyte. More likely answer. In beta thalassemia, we're going to see a normal or elevated erythrocyte count. 92. A baby has jaundice, hemolytic anemia, and elevated MCHC. So elevated MCHC really only comes up on in one condition on the boards, and that's hereditary spherocytosis. Autosomal dominant hereditary spherocytosis, defect in red blood cell membrane proteins, leading to the problem with the red blood cell formation, their shape. Question 93. A 6-hour-old infant born to a mother who had a preeclampsia with severe features has respiratory distress with a hematocrit of 71%. That's really high. Auscultation reveals normal heart sounds. What's the treatment? So here in polycythemia, this baby has polycythemia, we want to give fluids and glucose. Fluids because of the viscosity, and glucose because patients with polycythemia tend to develop hypoglycemia due to the increased red blood cell mass. So we want to give them fluids and glucose. That's the treatment for polycythemia of the infant. Question 94. An 18-year-old girl has nosebleeds and heavy menses. Hematocrit is 35%. Platelets are extremely low. Leukocytes 5,500. Spleen is not palpable. What's the cause? So here, this is production of platelet autoantibody. This is ITP, immune thrombocytopenia, where there are Ig autoantibodies against platelet membrane glycoproteins. We're up to pediatric musculoskeletal. Sunburst lytic bone lesions, that is osteosarcoma. Onion skinning, that is Ewing sarcoma. I like to think of Patrick Ewing with the onion, Patrick Ewing for Ewing, and onion for onion skinning, and that's how I differentiate it from osteosarcoma, where we see the sunburst pattern. 97, an 8-year-old boy has excessive daytime sleepiness despite good sleep hygiene. So he's sleeping well, but he's still sleepy. He has difficulty opening his hands after squeezing the physician's fingers. So that sounds like myotonic dystrophy. What's the mode of inheritance? That is autosomal dominant myotonic dystrophy. Remember, inability to open up a handshake can show up on exam day. 98. A boy with pseudohypertrophy of the gastrocnemius uses his arms to help stand up. What is the confirmatory test? So not CK, that's the initial test. Genetic testing is the confirmation. We look for absence of the dystrophin gene. Versus Becker, where the protein is present, just abnormal. In Duchenne, we look for the absence of the dystrophin gene. This is Duchenne muscular dystrophy. We get gene testing, but muscle biopsy can also be done for confirmation of the condition. Question 99. Green stick fractures requires reduction with casting in what after 2 weeks? We want to get Get a repeat x-ray to make sure that the fracture is healing properly. Question 100. Pain, pronation, and refusal to bend the elbow. This patient has nursemaid elbow. Where we see that the father or mother, for example, would pull on the baby's arm, they get nursemaid elbow, and they treat this with hyperpronation or supination with 90-degree flexion. Both of these can show up on exam day. The treatment for nursemaid elbow. Question 101. A 6-year-old boy falls onto an outstretched arm, which causes excruciating pain to his elbow. The x-ray is shown. What type of fracture is this? This is supracondyle humerus fracture. This is the most common pediatric elbow fracture, especially in boys from ages 5 to 8, and it can injure the brachial artery. It requires cast immobilization and may require closed reduction with pinning. Question 102. Overuse epiphysitis of the tibial tubercle, causing localized pain, especially with quadriceps contraction. What condition is this? This is Osgood-Schlatter disease, overuse of the epiphysitis of the tibial tubercle. It's seen in boys. Treatment is reduced activity for 2 to 3 months and neoprene brace for symptomatic relief. Question 103. A boy undergoes a fracture of the distal tibia growth plate, breaking the physis, metaphysis, but not the epiphysis. What type of Salter-Harris fracture is this? So this is type 2. In type 2, we see not go through the epiphysis. That's in type 3. (104) Developmental disorder caused by forward slipping of the vertebrae, causing a palpable step off. This is spondylolisthesis. Spondylolisthesis is where it moves forward. Remember that in spondylolysis, we see the breakage, and it's not until spondylolisthesis that it actually moves forward. 105. What is shown over here is this metatarsus adductus or clubfoot. So this is clubfoot over here. Metatarsus adductus, we see the foot turn in a little bit, but in clubfoot there's this severe deformity. It requires immediate casting, and there's no improvement, surgery within 3 to 6 months. Question 106. What is being assessed over here in this 5-week-old baby? This is an ultrasound of the hip. We want to make sure that this patient over here does not have congenital hip dysplasia, because perhaps he was a breech patient, and in breech patients we have to get an ultrasound at about 4 to 5 weeks. You get a spica cast by 6 months and surgery by 15 months if this congenital hip dysplasia does not resolve. Question 107. A 5-year-old boy presents with right hip pain with a slightly abducted and externally rotated hip. He had a URI last week. What's the next step? So over here we want to give ibuprofen and close follow-up. This is transient synovitis, where patients stand in abduction and external rotation. Transient, I have this mnemonic over here, A and E for abduction and external rotation. An awful mnemonic, but I hope you remember it. Question 108. A 7-year-old boy presents with a 2-month history of a left limp and needs discomfort. The patient recovered from URI last week, but now the patient looks healthy. Internal rotation abduction of the left hip is very limited, so we can't internally rotate or abduct. X-rays are normal. What is the diagnosis? So this is leg Calvé-Perthes disease. It's due to osteonecrosis of the femoral head. Question 109. A 13-year-old Perthes disease is due to osteonecrosis of the femoral head. Question 109. A 13-year-old obese boy. I don't need to say anything else. You know this is going to be slipped capital femoral epiphysis because this shows up in obese children. And we can see that in the picture over here with femur head displacement. And it often affects both sides. Now we're going to talk about child abuse. 110. Which claim or scenario is suspicious for child abuse? And the answer is all of the above. My 2-month-old rolled off the couch because that doesn't happen at that age. Well-circumscribed burns, and parents with drug abuse. Question 111. Which organism would be used to check for child abuse? And the answer is Neisseria. Chlamydia would not prove child abuse because it became acquired by the mother during delivery and persists up to 3 years. So if a patient, a 2-year-old girl, for example, has chlamydia, it could be from the mother. But Neisseria would not, and therefore Neisseria could prove child abuse, for example, in a 2-year-old girl. Here's more on child abuse. You can take a look at this. We have to, of course, notify Child Protective Services. We hospitalize the patient to stabilize and protect, Antibiotics and high-dose oral contraceptives are given to those with sex abuse. Child wellness. So 112. Seats can face forward if the child is both A and B, older than 2 and weighs more than 40 pounds. Alright, other safety measures include babies should sleep on their back, no stuffed animals, and no soft blankets because they increase the risk for sudden infant death syndrome. Question 113. Cow's milk can be introduced at 12 months, not at 6 months, at 12 months. At 6 months we're in solids start, and we introduce solids gradually. Question 114. Strabismus is normal until what age? Strabismus is normal until 4 months of age. Patient may require corrective lenses after that, in occlusion with a patch and or surgery to prevent amblyopia. Question 115. Which of the following is a contraindication to vaccination? Well, people with a low-grade fever can get vaccines. Current antibiotic therapy is not a contraindication. Prematurity is not a contraindication. But if a preterm baby weighs less than 2 pounds, they cannot get the hepatitis B vaccine. We wait until discharge or 1 month of age. We don't give it to them right away. All right, here are other contraindications to vaccines. For example, rotavirus. Patients should not get rotavirus if they have a history of intussusception, because rotavirus can increase the risk of intussusception or can be an instigating factor for it. Additional questions. So here, from here on in, it's just going to be a whole bunch of questions from various sections. 117. Bilateral parotitis in a child is most likely due to mumps or Staph aureus. Mumps. Staph aureus would be unilateral. Question 118. Pustules and honey cluster crosses on an erythematous base. The bullous type is caused by, so of course this is impetigo. Bullous is Staph aureus. Strep pyogenes cause the non-bullous type, and for this we give mupirocin. If it's severe, we have to give oral, but mupirocin is first line. 119. Rapid onset, sharp, raised borders, and intense erythema. This is erysipelas. Cellulitis doesn't have these raised borders, and they're not sharp raised borders. It's more like indistinct, not well defined. We treat erysipelas with cephalosporin and penicillin, and it's caused mostly by strep pyogenes. 120. This case of necrotizing fasciitis is due to, this is C. perfringens, because if you can see, we see the gas bubbles over there. That's C. perfringens. 121. Sore throat, red tongue, and the following rash. What is this? This is scarlet fever, where we see this, the sandpaper rash. Which kidney disease occurs days after strep pyogenes URI? This is IgA nephropathy, because post-strep glomerulonephritis does not show days after, it shows up a few weeks after. IgA nephropathy occurs a few days after strep pyogenes URI, or even concurrent with the URI. 123. What are the two most common bugs that cause gastroenteritis? And these are rotavirus and norovirus. These cause gastroenteritis, watery diarrhea. Right, rotavirus in the winter months, and norovirus occurs in daycare centers and cruise ships. So if you have a lot of people on a cruise ship that get diarrhea, you know it's norovirus. Question 124. Which bug mimics appendicitis? So this is Yersinia. It causes pseudoappendicitis. 125. How is EBV treated? EBV is treated with supportive care. Steroids for airway compromise caused by tonsil enlargement, and severe thrombocytopenia or severe anemia. But there's no effective antiviral therapy for EBV treatment. Right. The best initial test is the heterophile antibody. Patients should be advised to avoid contact sports for at least a month, and complications include nasopharyngeal carcinoma, especially in Asians. Remember that if you give these patients penicillin, they may develop a rash. 126. Cystic fibrosis and non-resolving symptoms of lower respiratory inflammation, high IgE. What condition is this? This is bronchopulmonary aspergillosis, which we see in cystic fibrosis patients. And aspergillus spores is what leads to high levels of circulating IgE. And we have to suspect this condition when we see persistent lower respiratory infection symptoms despite adequate antibiotic therapy. Question 127. A 17-year-old boy with a history of stem cell transplantation and a 3-day history of fever, chest pain, and cough now coughs up a small amount of red blood. Antibiotics haven't helped. He has a fever, low blood pressure. You can just take a look at the scan over here. This is an aspergilloma. This is invasive aspergillosis affecting the upper lobe. Remember, what affects the upper lobe? TB, aspergilloma, and silicosis are conditions which affect the upper lobe. By the way, aspergillus is a fungus that we encounter every day. It only affects people who are severely immunocompromised. For example, people who are post-transplant. All right, 128. A 3-year-old girl has a fever, shortness of breath, and signs of pneumonia. Pleural effusion is seen on CXR with fluid analysis showing pH 7.2, elevated LDH, and low glucose, in addition to elevated leukocytes. What is the diagnosis? So over here, we see a low pH and an elevated LDH. That is an empyema. The glucose concentration in empyema is decreased due to the high metabolic activity of leukocytes and or bacteria in the fluid. And by the way, in a malignant effusion, we're unlikely to see elevated leukocytes. Question 129. A child with pneumonia has sputum culture revealing strep pneumonia. CXR shows right lower lobe infiltrate. He started on ampicillin and ceftriaxone. 3 days later, there is no improvement. What's the next step? So of course, we want to get a repeat chest x-ray. Children with pneumonia on appropriate antibiotic therapy who have no improvement after 2 days will require this chest x-ray to assess for complications such as an effusion. Question 130. A 2-week-old girl has upper respiratory symptoms. Temperature is 100, wheezels and crackles, and respiratory distress. What's the treatment? So here we want to give supportive care. This is RSV, bronchiolitis. Question 131. A 17-year-old girl with a day history of nasal congestion, sore throat, and dry cough now has cough with blood-tinged sputum. She has scattered bilateral wheezes and crackles. Chest x-ray shows clear lung fields. Temperature is 98. She is a non-smoker. What's the next step? So here, this is symptomatic treatment. This is not a problem. This is acute bronchitis. Acute bronchitis can present with blood-tinged sputum, but since we don't see any indications of pneumonia, she can go home. She's fine. Symptomatic treatment. 132. Increased breath sounds and dullness percussion are seen in lobar pneumonia. Lobar pneumonia, there's increased breath sounds and dullness percussion. The reason is because there's consolidation and sound goes more efficiently and rapidly through consolidated lung, as opposed to in these other conditions where we see diminished or absent breath sounds. Question 133. A 2-year-old boy with croup, bark and cough, has an inspiratory stridor at rest. He should be given dexamethasone and nebulized epinephrine. Mild cases of croup are treated with steroids, but we may need to give racemic epinephrine as we see over here. 134. What is the mechanism involved in the condition associated with the image? Over here, where we see the steeple sign, that is edema. Croup, the narrowing of the proximal trachea. There's edema and narrowing of the proximal trachea resulting in the bark and cough and inspiratory stridor. 135. A 6-year-old boy has noisy night breathing and gasps for air while breathing. He has normal height and weight. What's the most likely diagnosis? So this is not choanal atresia. This is obstructive sleep apnea caused, for example, by adenotonsillar hypertrophy. We have to give these patients some sort of surgery in order to treat the obstruction. 136. An 11-year-old boy from Asia develops severe abdominal pain and signs of SBO. He has no previous surgeries, so this is not adhesions. Eosinophils 50%. What's the diagnosis? So it's ascariasis. That's why the eosinophils are high, because of the infection. 137. How is Rocky Mountain spotted fever treated? So we treat it with doxycycline. 138. How is babesiosis treated? We treat it with azithromycin and atovaquone. Babesia infects red blood cells causing hemolysis. 139. How is anthrax treated? So over here on the left we see cutaneous anthrax, and on the right we see pulmonary anthrax, where we see the widened mediastinum. How is it treated? Quinolone or doxycycline or even ciprofloxacin. These are all treatments for anthrax. And there's no person-to-person spread of anthrax, rather it's inhaled or ingested. 140. A patient has a fever along with a single ulcerative skin lesion at the site of transmission. For example, there's an animal bite. And the patient has painful regional lymphadenitis that develops over a week. This is seen in tularemia. For example, the rabbits, typical rabbits, ticks, and bioterror. We see tularemia, purulent conjunctivitis, and suppurative periauricular lymphadenitis, where we see these signs should raise suspicion for infection with Francisella tularensis, causing tularemia. 141. What is the treatment for whooping cough? The treatment for whooping cough is a macrolide such as azithromycin or erythromycin, and we have to treat close contacts. Although vaccination reduces the infection risk, immunity wanes over 5 to 10 years. 142. How is mild cholera treated? It's treated with massive hydration. Doxycycline can treat severe disease. Here are cholera facts. Present with massive watery non-bloody diarrhea without treatment. Hypokalemia and acidosis result in 50% mortality. Patients should continue to eat food while hydrating. 143. What is the first test in suspected endocarditis? Blood culture. It's more than 95% sensitive. And
Ugh, I gotta use the bathroom again. Okay, let me think. Man, he beat my boy Hyperflame. Rest in pieces. I'll be right back. I'm gonna go use the restroom. had to run it. They had to run it back. Who won? Yo, MSB. Let's go. Let's go, MSB. I can't believe MSB is even alive. Wow, the tournament's over. Yo, Jackie? Jackie! Jackie, say what's up to me, bro.
But we will be getting the Rano and the Maple first, Elkies and Toothbrush. Presumably Toothbrush probably needs like a moment to like drink some water and take a because that was an intense game 5.
Okay, yeah.
So we have seen this matchup come up a few times today. Barking Frog 2-1 to T. Richard in pools. That was a really close.
Hold on, I gotta say what's up. I gotta say what's up to my boy Jackie. Jackie on the mic. Let's go. Okay, back to being serious. Where is my stupid thing? side. Caposiform hemangioendothelioma. Kasabach-Merritt syndrome. Just, how does my BeastMD look? I'm so dumb. I should do this again. Copy. And then paste to duplicate. And this is the way you do. Okay. How does this look? Okay, I'm okay with the purple, I guess. This patient presents after blunt abdominal trauma with a midline mass. He's concerned for duodenal hematoma. Oh, I didn't know that was a thing. Increased amylase and lipase concentrations have been shown to correlate with intra-abdominal injury after blunt trauma to the abdomen. Oh, am I on the right thing? Yeah. So this boy who had diarrhea, cough, cries, of vomiting for 5 days. Yeah, who now has a red urine. So HUS typically associated with E. coli caused by production of shiga-toxin. Present kids with bloody diarrhea, accompanied by microangiopathic hemolytic anemia, thrombocytopenic acute kidney injury. Dummy. Why'd I do that? Dummy. Oh, I turn the music back up. Bro, you said I can never focus as much. My ADHD is stronger than Arnold in his prime. Bro, no, it's hard, bro. Literally, like, even I can't even focus. Like, you see, I don't know if you noticed, you see the layout's different, right? I freaking, in the midst of studying, I freaking put this purple, how do you say it? I got this purple thing on my stream, and like, you know, I'm taking breaks. You know, I'm so horrible at studying and focusing. That's why I'm doing this stream, because I can't focus. Oops. Yeah, my focus is horrible, bro. Oh, I gotta put something in the chat. How the purple looking though? Never mind. I can't do this. Let me focus on the task at hand. I might have to put this on repeat. Has he made any new music? Oh, he's okay. Omni Blaze. He got the free, that boy Jet the Hawk. 2025. Let me turn that repeat off. Fool has the modded Sonic Riders on here. Sampling Mania. Here's Omni Blaze. I gotta check out this album. But I think I want to check this out first. What is this? Where am I gonna put this? this whole album in the queue. And then I'll put this song back in. I need your playlist because the fact that you even know all the music I play in the background is crazy. You gotta I have so many steady music playlists. This one has 500 songs. This is just my flow state. That's just the ones I know that, like, if I would play any of them on repeat, I know I could just like stay locked in, like the trance, the flow state. This one, I just have a whole bunch of gaming lo-fi and all sorts of just gaming songs. This, of course, my anime one. This one is like my more low-key stuff. And then this is just all my just lo-fi. And then this is like everything combined together. And it's because I know that if I just put on, like, you know how they have the like the lo-fi girl and they just plays random lo-fi. If I'm listening to something and I like it, I will literally like, I get very sentimental about like songs I hear. So then I'll be thinking like, bro, this mug sounds so good and I'm never going to hear it again. And so then I will stop what I'm doing and then I will put it into one of my own playlists just so that I at least will know this is not my last time in my entire life I'm going to listen to it. And so that's why I realized I just have to make my own stuff, because then at least I won't lose track of anything. Dang, this song was fire. I don't even know how to pronounce the fool's name. But yeah, I can send you my my steady playlist on Discord if you want. But yeah, I love like the Ridge Racer type music. I know this is not Ridge Racer, but you know, that feels like you could put it in the. Have you ever listened to the Ridge Racer album? The bet, bro. Have you ever heard the Ridge Racer 4? What is it called? Yeah, it is called Ridge Racer 4. That's like the here, let me see. Oh no, it's not called Ridge Racer 4. It's called I guess it's called, what is that game called? Do you know what game I'm talking about? Okay, so bro, have you ever heard what's that song called? By JPEG Mafia. How I even heard about this kind of music or started listening to it is because it's not on Spotify no more. Oh no, it's called Bald. I'm gonna let this play for a little bit, but the sample he uses in the song like changed my life. Like, and this is from a racing game.
Yeah. Fuck that. Whoa. Fuck that bitch, I changed the plan. Switch my style.
This game right here, this old freaking game came out in 1996. This Namco game. This game has like the best video game soundtrack ever. You just have to. It's very hard to find it on Spotify. They have some of the Namco songs, but it's like in a weird order, and they don't have all the songs. They have all these extra songs. So you need to go on YouTube. You need to listen to Ridge Racer 4, and that's like, ever since listening to that mug, that's like changed like my taste in music. And so like I always be trying to look for the fools with the Ridge Racer vibes. I think I do have a where I do have a playlist. This is all my Ridge Racer inspired music, and then have my Rage Racer music. That's like the more crazy energy. But yeah, I love that video game. I haven't even played it. I really want to play it just for the soundtrack, because I'm trying to imagine being a little kid listening to that mug. Just listen to just some amazing tunes like that. You don't even know what's going on. But yeah, don't I have? That's crazy, because I thought I found the I thought I found all of the Namco music on here. Oh, here it is, right here. This is. I'll just play this, and then I'm gonna try to focus on the steady again. But this, one of the greatest video game songs of all time, bro. Mud goes so hard. You had that game? What in the world? It's. I know they had a whole bunch, but yeah, this song, bro. You gotta bust it out. If you still have it, you could probably get a lot of money for it, honestly. Let me see. Okay, then I'm gonna focus. Shopping. How much? Okay. Okay, for Fool's not even charging that much on eBay. Never mind. I would low-key buy this game. Wow. Oh, this is the newer Ridge Racer. Yeah, check that album out, bro. Oh, my top 5 anime? Top 5 anime? Hold on. And then this is me and my little study break. This is study break. Oh, you said this? Yeah, find it disc, bro. Find it disc for real. That's cool. Okay. You want to know top 5 anime? I'm gonna have my screens hit. I don't know my top 5 right now. I mean, I know most of it. This might be my number 5. Okay, let me find. I'm trying to find a better picture. Actually, let me just find all of them. So that's my number 1. Oh, you know my number 1. I got that mug ready. And then let me see. My number 2. Got my number 2 ready. Now, like 3 and 4 and all that, I'm not exact. I can't even really remember. And this one I'm about to put in my top 5. I don't even know if it's really my top 5 anymore. It might be more nostalgia than anything. I'm gonna put that at number 4, because that might just be nostalgia. And then I have my number 5, I have my number 4, I have my number 2, and my number 1. What's my number 3? My number 3. I have all these others in my top 10, but let me just. I gotta put something. It's. What am I gonna put? I'm gonna give me like 10 seconds. Dang. I guess I'll put this in here. I guess this is in here. I'll put this. I'll put this at my number 3. I don't think this is. I don't think this is true at all. At least right now. This is not. I know that's not true. At the moment, this is not true. I'm just putting something in there. I actually want to just put this at number 5. Put that at number 5. I don't know what to do. Okay, my top 5 anime. This is number 5. This is really not number 5. But I couldn't think of what else to put. I really do like My Hero, but I know the manga ended. I haven't finished. I'm not caught up on the manga. I know there's only one more season left, and I feel like if they don't do a sequel season or like a sequel show, then I don't know if it's gonna be top 5. But if they do, then I could see it being top 5 for real. And then number 4. I gotta go Ping Pong the Animation. this is like, I watched this manga so many times. It's only like 11 episodes, but it is so amazing. And like the art style of the anime is so ugly. Like when you see it in the first 2 seconds, you're like, bro, this is the ugliest anime I've ever seen. But then it's like you get used. It's like three episodes in, it's like you see the vision, and it's like the animation is so like, it's so like weird and like, oh my goodness. But it's so like, I just love the storytelling, and like all the characters are so good, and it's so good that every time I've watched it, my favorite character has changed like each time. And I'm like very particular about picking favorites in general. And like when I make something my favorite, I really try not to change it. It's like the fact that it had me changing my favorites, that's how you know, like all these fools on here go so crazy. He's been my favorite, he's been my favorite, he's been my favorite. And then there's a different fool who's been my favorite. So that's number 4. And of course, I had to put the OG. This is my first anime. I had to put it on here. I don't know if it's still in my top 5. I definitely don't think it's really 3. But like I just have a soft spot for Naruto. And then the number 2, this was my favorite anime for a long time. And like I've seen this mug at least like 4 or 5 times. Like, and I've read the manga and everything. And so I love Hunter x Hunter. And I'm about to watch the 1999 version just because this mug is so good. Just the fighting and everything. The storytelling, the characters. You know, Gon, that's my favorite. I love Gon, I love Knuckle, and I love Shoot. And I think those are my 3. But low-key, Kurapika, he's one of my goats too. When I first watched it, I initially thought he was going to be my favorite, but he didn't really do anything throughout the show. So, and then of course the number 1. So this is my favorite anime for a long time. And I remember, and of course I really hate to change stuff. So even saying Naruto wasn't my favorite to put Hunter on top, that was a big thing. And so the next anime, my favorite right now, I literally watched, it was episode 4. By episode 4, it was already my favorite anime. And so, had to put that mug, JoJo no Kimi no Boken. This is my all-time favorite. And like, the first episode of JoJo is like my comfort. It's the most crazy episode you ever see, but that's like my comfort. That's like my comfort anime episode. I love the first season of JoJo. I love all of JoJo. And you know, I've read the manga. I read everything in the manga multiple times. I watched the anime I don't know how many times. And I think my next thing I need to do, I need to watch it in English. Because I've only seen the first season in English. So I need to watch everything in English just out of curiosity. But yeah, that's my top 5. And then, you know, I love this might be top 5. This might be number 5, honestly. I really love Don't Toy With Me Nagatoro. That mug is fire. You know what's cool? Because I don't even like slice of life like that. At least I didn't. And I don't like Eki or any shows like that. Like, I've never watched a show like that before. And I actually tried to watch it years ago, and I literally turned it off in the middle of the first episode because that mug I couldn't watch that mess. But literally, it was last summer. I watched the first season in like 2 days, and then and then I watched the second season, and then I caught up to the entire manga, and then I rewatched the anime again, first and second season, reread the manga again, and then I started over from the manga at the very beginning from chapter 1, and then read the manga again. And that's all in the span of like 3-4 weeks. And so, like, I think that's like that's how I really know I like something, is if I be repeating something. I be watching it over and over. I don't know why. I just do that. I love to be repeating. Like, even music, you know, there's so many like new music I don't be listening to because I keep listening to my old one. And so, Nagatoro, that probably has to be number 5, but you know, it's hard to put something like that in the top 5 and expect it to be taken seriously. My Hero Power of Friendship anime. Also, spoilers: the ending sucks. There's no sequel. I mean, who knows if they're gonna do a sequel? Because I didn't read the last chapter, but I saw like some panels of the last chapter. I don't know how the whole thing with Shigaraki gets resolved. I just know what happens, like him as like an adult, and then I know like he don't have his powers or whatever, and so, which at first I was like, bro, that's so disrespectful. Like, cause the thing is, I didn't know what was going on, but y'all kept posting the memes about Midoriya working in the in Burger King. They kept posting the memes, bro, and then so. But I mean, we might get a sequel. We don't know. But yeah, Ping Pong the animation. It's literally called, like, the manga is called Ping Pong, and then the anime is Ping Pong the animation. And it was anime of the year in like 2011, or like I think it won the Crunchyroll Awards for like anime of the year or something like that. Whatever anime award show they had. Yo, what song is this? Yo, this is a lot. What game is this? Lobby theme. Bro, I don't know what. This ain't no game, but whatever. If this was a real game. But yeah, Hunter x Hunter, the number one. Yeah, Hunter x Hunter. That's to me, that's just one of the best animes of all time. I know, I understand. I don't know when you left, but yeah, I said I'm not sure about My Hero if we really won't get a sequel or not. It'll depend on what's his next work if he does. If he starts making a new manga and it's just something completely else, then yeah, that's the sequel dream is over. But I mean, Fool definitely could make a sequel. Like they could literally do a Boruto of My Hero if they wanted to. But you know, of course, you know, Boruto it hurt Naruto's legacy so much, so he may not want to do that. Have I seen Darling in the Franxx? I had started watching it when it first came out. When it first came out, I was watching them episodes like weekly, and then I can't remember how far I got, but I was gonna wait for the episodes to stack up, and then I didn't catch up. So yeah, I think I only watched like 3 episodes, but I just didn't have any. There were no characters I liked, or like I didn't feel any motivated to keep watching. But when that show was coming out, that's what everybody was talking about, Darling in the Franxx. Yeah, Nagatoro, it's that for the first episode of Nagatoro, that's like one of the worst, not one of the worst anime episodes, but it's like, you know, it's like, it's a romance show, but she be like bullying him or whatever, like he's like a lame, so she be messing with him. But the first episode, she be legit bullying him, like literally, like, just spoiler alert, she makes him cry in the first episode. And so that's when I turn the mess off. I'm like, I don't know what kind of bullying, whatever you got going on with the writer, with bullying, blah, blah, blah. But I'm like, I was like, I turned that mess off. Because the main reason I watched it because she was black. That's the only reason I had any desire to watch it, especially when it was coming out. And so, and not even that, she makes him cry twice in the first episode. And it is just so, like, it was just weird. But crazy enough, like, in the second episode onward, she is never ever that mean again. Like, I think originally that manga was just like a webcomic, and then it got picked up because it was that popular. So I feel like I didn't read the webcomic, but I assumed that he was making it for fun, and he realized, like, oh snap, this is not gonna be serious. So then he stopped being wild. But yeah, Nagatoro, I think the reason I started watching it is because there's a scene of them playing video games together, and it was just so wholesome. I was like, you know, I just wanted to see what was up. And of course, like I said, she black, so of course I wanted to watch that mug. This song goes hard too. This whole album is pretty cold. And then sorry, I gotta add this message to my playlist. Even though I haven't finished all these songs, I have faith that the rest of that mug gonna be lit. Yeah, Naruto, OG Naruto and Shippuden, they both go so hard. Bro, and Kaguya, I finally watched Kaguya this, I watched Kaguya Sama like last month, or like around January, I finally watched it. That mug is one of like the best anime, that might be top 10 too. That's one of the best anime I've ever seen. Not even like, I'm talking about just anime wise, like animation. Like that anime was so unique. It just, like the stuff, it was like every episode they're pulling out different stuff, like different techniques and all of these things. Like it always kept, just the animation on its own, just visually kept you on your toes so much. And one thing about that anime is that like the characters, bro, like they really didn't fit no tropes, like typical tropes that I thought they were gonna be in. Like what's Pink Girl's name? Her name starts with a C. I forgot her name. But she is so different than what I assumed she's gonna be from like the first episode. Like they're all like very good 3D characters. But okay, I gotta, yeah, let me. Did I ever make another season to Darling in the Franxx? But I'll have to go back and watch that mug. Also, let me know if you like this purple that I put on here, because it used to be, if you go rewind into the stream, like when it first starts, it was just black, and so I've added this stuff in. I don't know if that looks better or not, or you think I should just keep it black or just keep the bottom purple. Was toxic, so it ended. Let me see this list. Wait, is it gonna be season 2 or is it like ended? Oh, it has a complete ending. Oh, okay, yeah, I guess I'll just watch. And the thing is, at the time when I was watching, I also didn't really like mechas like that. But since then, like I've seen Code Geass, I've watched Neon Genesis, and so I do like mecha a little bit now. And I've seen the Promare movie. I don't know if you ever saw Promare, but that's made by the same people who made Gurren Lagann. This is like the anime movie. This mug goes hard. So this is also like, has a lot of mecha stuff. But bro, I've been drinking so much water. Kaguya-sama's like overthinking on cocaine. That's what I'm saying. Like, they're so, like, they literally were like on, like they were in Death Note. Like, the mug when it was raining outside, the craziest one is when it was raining. And it was literally like the umbrellas, and it was like, oh, like, I forgot my umbrella. Like, oh, I guess I gotta be under your umbrella. And they none of them want to say they got an umbrella. And she literally had it so planned out. Like, literally, that missus. She's so crazy. Okay, thank you. Okay, but yeah, I'm gonna go use the restroom. And then I'm gonna try to go through this mug, because it's almost midnight where I'm at. Oh, it is. It's almost 1 a.m. where I'm at. So I'm gonna have to bust through some more stuff. But yeah, I love Kaguya-sama, and I be reading the manga as well. Like I have the manga on my phone. And but yeah, I don't know if you finished that ending. But yeah, I'll be right back. All right, I'm black. I'm East Coast too, my boy. I need to edit too, so go ahead and focus. I'll listen to music while I drink. Bet, bro. Yeah, I'm East Coast for school. I'm from Houston originally, and so yeah, I'm in DC for school, and then eventually I'll be shooting to New York and residency in New York. So I'll be East Coast for a few years. But okay, let's get into this mess. Dog, this song is so fire. I don't have you on my Spotify. I'm gonna have to follow you after I get my phone. I'm not really rocking with this song as much. Okay, never mind. Why supportive therapy? Because ruptures are gonna freaking hurt, I thought. No, yeah, it's already hurting her. So he's gonna watch. A ruptured corpus luteum cyst classically presents with a unilateral pelvic with lower abdominal pain that is sudden in onset and severe. So she has just a ticking time bomb. You're not gonna do anything. That sucks. This sounds so gorgeous. Dang. Physiologic flow murmur. Congo drums. kind of doctor do I want to be? I want to do family medicine. So that's like, oh, it's mine. Okay, never mind. Family medicine, that's like, that's just your regular, your primary care doctor. My mom's a family medicine doctor, so that's like, literally like every summer, like most of my siblings, we would all have to end up helping out in her clinic and just working there. And so I don't really like being in the hospital, so I like family medicine, and I like kids too, so I like pediatrics. But family medicine, they see like everybody. They see kids too. So and then I also like OBGYN, but family does that, a little bit of that too. So they basically do everything. I basically like everything. I just don't like being in the hospital. So I think that's the best fit for me. And I like talking to people. Complement system immunodeficiency. This patient has a meningococcemia. Song is good. Cause of pulmonary hypertension in infants, bronchopulmonary dysplasia. This register syndrome requiring intubation, mechanical ventilation. first half of the menstrual cycle, the follicular phase begins with menses and varies in length. During menses, FSH and LH increase and stimulate the developing follicle. Follicle produces estrogen to proliferation of endometrium. As estrogen rises, corpus luteum secretes progesterone to maintain the endometrial lining. And no implantation occurs, corpus luteum degrades. Estrogen and progesterone continue to decrease. Mine increases to FSH. Day 21 should be expected to be in the luteal phase of her menstrual cycle, at which time the corpus luteum should be secreting progesterone. This patient is lower than normal progesterone. It is unlikely that ovulation has occurred, and ovulatory cycles can lead to heavy menstrual bleeding and menstrual periods, as estrogen is still being secreted by developing follicles to cause endometrial proliferation, but progesterone concentrations are too low to maintain the endometrium. Let's see. Nalapro is an ACE inhibitor, angiotensin converting enzyme, which converts ACE1 to angiotensin 1 to angiotensin 2. If ACE2 inhibition of angiotensin production has a secondary effect of suppressing aldosterone. Female newborn with mild cyanosis, cardiac murmur 4 hours, and she has Alzheimer's. Complex congenital heart defect. Spleen functions to remove opsonized pathogens. Yo, this album is so fire. Like a pediatrician or OBGYN. Well, yeah, pediatrician, that would be just a kid doctor, and OBGYN, that would just be the woman's doctor. But family medicine, they can do pediatrician things, they can do woman doctor things, and just when you're just a normal adult, that's just who you see, who you typically get a checkup at like every year. And and even like at your, or like if you ever go to the hospital, you always have to follow up with your family medicine doctor. So like I would like being a pediatrician, but there's also like so many, just because like you have to do so many checkups as a kid, I feel like it would be like a little like repetitive. There's so many like milestones that that the kids have to meet, and it's like a lot of like making sure they're meeting their milestones. And so, and I even though I really love kids, I do like I like elderly patients a lot actually, and I do like seeing adults too. And so, and I think like some parents might be annoying, like, you know, especially with the climate right now, with like medicine and vaccines and all this stuff. Like, it would just, I feel like it'd feel a little frustrating. And but yeah, like at least if it's like an adult refusing treatment or stuff like that, like at least it's like that's messing with their own body versus like the kid. But you know, I mean, there's things annoying about like being any kind of doctor, I feel like. And in OBGYN, I mean, I want to care for male patients too. Especially like a black man, like a lot of us, we don't be going to the doctor and things like that. Like, you know, it's important to have black doctors in general, black male doctors. And so I like to see everybody. Aspirin is an antiplatelet agent that irreversibly inactivates cyclooxygenase, which prevents the conversion of recognitic acid to chromoxin A2. Involved platelet activation has decreased in disease results and diminished liver activation. Salicylate poisoning in polyps. Large doses of respiratory alkalosis. ventilation of restrictions causing hyperventilation. Subsequently, it results in development of delayed and metabolic acidosis. So you need to test the Straddle injury results in large perineal hematoma and blood at the urethral meatus or urethral injury. Difficulty avoiding blood at the urethral meatus, perineal ecchymosis may be associated with a pelvic fracture. Spontaneous bacterial peritonitis, bacterial infection of acidic fluid. What were the balloons for? What the world? All right, I'm through. I'm through. Thanks for coming to the stream. For anybody who came, hope y'all enjoy the rest of y'all's day. I mean, y'all's evening. And I'll be streaming tomorrow because this exam going on. So I'll see y'all fools. Peace.